Hello viewers, you are watching me, Zahur Islam. Today my lecture is about the psychological disorders. So you can see here, psychological disorders, or you can say mental disorders. So mental disorders is a syndrome characterized by the clinically significant disturbance in an individual cognitions, emotion regulation, or behavior that reflect dysfunction in the psychological, social, or developmental process. Mental disorders are usually associated with significant distress or disability in social, occupational, or other important activities. The sign symptoms which are reported in the form of a symptoms as a single indicator of your problems. So it can involve affect behavior or cognitions. The syndrome is a group or the cluster of the symptoms that all occur together. You can see here mental disorder. The syndrome or the group of symptoms characterized by significant disturbance and cognitions and emotions and behaviors. So this will lead to significant distress or impairment in social, occupational, or other important activities. This is the categories of disorders, and these are the examples. So for example, neurodevelopmental disorders. The classical example is intellectual disability like mental retardation, specific learning disorders, autism, attention deficit hyperactivity disorder, that is called ADHD, while another one is schizophrenia spectrum and related disorders, which is the classical examples are delusions disorder or schizophrenia. Bipolar and related disorders are bipolar 1 disorder or bipolar 2 disorders. Disruptive impulse control and related disorders, that's the classical example is conduct disorders, while the anxiety disorder is concerns with social anxiety disorder like social phobias and panic disorders. Another one is obsessive compulsive and related disorders, so which is directly correlated with obsessive compulsive disorders, so which can be abbreviated by OCD. Another one is trauma and stress related disorders. The examples are post-traumatic stress disorders or PTSD or adjustment disorders. Another one is somatic systems or somatic symptoms and related disorders, which are also called convergence disorders. Another one is substance related and addictive disorders, that is tobacco use disorder or tobacco withdrawals. Sleep walk disorders, that is insomnia, while personality disorder are antisocial personality disorders, and the eating disorder is bulimia nervosa and anorexia nervosa. Now let's see here the schizophrenia spectrum and related disorders, the class of disorders in which the severe distortion of reality occurs. The symptom characteristics of schizophrenia spectrum disorder decline from a previous level of functioning. So an individual can no longer carry out activities he or she was once able to do. One is hallucinations. So hallucination means the experience of perceiving things that do not actually exist. Delusions, it is firmly held unshakable beliefs with no basis in reality. Example of theme of delusion is persecutory delusions. So one is going to be harmed by another individual, organizations, or other groups. Grandiose delusions, when an individual believes that he or she has an exceptional qualities, fame, and wealth. somatic delusions, that is preoccupations regarding health and organs. So that is somatic delusions. Disorganized thinking, speech. So people with schizophrenia use logic and language in a specific way. So their thinking often doesn't make sense and their logic is frequently faulty. Abnormal motor behavior, for examples, you can see here maintaining, the person become unable to maintain its position. So for examples, maintaining in rigid postures, complete lack of verbal or motor responses, so purposeless excessive motor activity, etc. Neurodevelopmental disorders is a group of conditions with onset and the developmental periods. So the disorder typically manifests early in development, often before the child enters grade school, and they can produce impairment of personal, social, academic, or occupational functionings. The examples are intellectual disability. So intellectual disability, it is disorders with onset during the developmental periods that include both the deficiencies in individual and adaptive functionings. Attention deficit hyperactivity disorder. So it is a persistent pattern of attentions and or hyperactivities, for example, impulsivity, that interfere with functioning or development. So other examples, that is specific learning disorder or childhood onset fluency disorder or stutterings. Mood disorders, that's the first one is depressive disorder. So in depressive disorder, this common feature of all these disorders is the presence of sad, empty, or irritable mood, accompanied by somatic and cognitive changes that significantly affect the individual capacity to function. So for examples, the major depressive disorder and cyclothymic disorders. Another one is bipolar and related disorders. So bipolar disorder, that is also called, for examples, bipolar 1 disorder and bipolar 2 disorders. So bipolar disorders, a disorder in which a person alternates between a period of euphoric feelings of mania and period of depression. Anxiety disorders, so this category include disorders that share features of excessive fear and anxiety and related behavior disturbance. So anxiety disorder differ from developmentally normative fear or anxiety by being excessive or persistent. So for example, that is specific phobia, separation anxiety disorder, and panic disorders. You can see here the phobic disorder description and example. For example, agoraphobia. So agoraphobia means a fear of places such as unfamiliar, crowded spaces where help might not be available in case of emergency. Person becomes housebound because any place other than the person home arouses extreme anxiety symptoms. So actually, or in this case, the persons become housebound. While in specific phobia, so fear of specific objects, places, or situations. While the animal type is specific animals, for example, insects, so person is extreme fear of dogs, cats, or spiders. While the natural type is event or situation in the natural environment, so person is extreme fear of storms, height, or waters. Situation type or public transportations, tunnels, bridge, elevator, flying, driving, so person become extremely claustrophobic in elevators. While the blood injections, injury type, so blood injury and injection, so person panics when viewing a child's scraped knee. While the social phobia is a fear of being judged or embarrassed by others, so person avoids all social situations and becomes a recluse for the fear of encountering other judgment. Obsessive compulsive and related disorders, OCD, is characterized by the presence of obsessions or compulsions. Obsessions are recurrent and persistent thoughts, argues that are experienced as intrusive and unwanted. Compulsions, irrational acts that person feels driven to repeat. So it helps individual block out anxiety caused by obsessions. For example, obsessive compulsive disorders, feelings and eating disorders. So these disorders are characterized by persistence, disturbance of eating or eating related behavior that significantly impairs physical health or psychosocial functioning. For example, fecal rumination disorders, anorexia nervosa, and bulimia nervosa. Now look at here's anorexia nervosa. This is a condition which is characterized by significantly low body weight, and there is intense fear of gaining weight or of becoming fat or persistent behaviors that interfere with weight gains. Even thought at a significantly low weight and disturbance in the way in which one's body weight or shape is experienced and induce influence of the body weight, shape, or self-evaluations. So look at here. This is anorexia nervosa. Somatic symptom and related disorders, psychological difficulties that take on a physical somatic form but for which there is no medical cause. For example, convergent disorders, one or more symptoms of altered voluntary motor or sensory function. So symptoms cannot be explained by medical disorder. Trauma and stress related disorders. So this disorder characterized by psychological stress following a stressful or traumatic event. For example, post-traumatic stress disorder, exposure to actual or threatened death, serious injury, sexual violence. And some of the symptoms include recurrent distressing memories and dreams associated with traumatic event, flashbacks, avoidance of stimuli associated with traumatic event, hypervigilance and sleep disturbance, problem in concentration, inability to experience positive emotions, etc. Substances related and addictive disorders. It include difficulties associated with 10 classes of drugs like alcohol, caffeine, tobacco, opioids, and sedative cannabis. This category of disorder includes substances use disorders, impaired control, social impairment, risky use, tolerance and withdrawals, substances induced disorders, substance intoxication, substance withdrawals. Difference between a psychiatrist and psychologist. When to seek helps. So inshallah in my next lectures we will talk about how we can differentiate between psychiatrist and psychologist.